This will take a look at the anatomy of a scapula bone full size, first posterior, then anterior, and then lateral. Here's the spine of the scapula from the posterior view, sometimes referred to as the shoulder blade. Then to the top of it, or the most superior part, is the acromion process. And then the coracoid there would be toward the anterior, because don't forget this is a posterior view. We'll see the coracoid later on another view. This trench or groove here, or fossa, is called the supraspinatus fossa. Don't forget, muscles are going to be attaching to all these markings. This is the body of the scapula, that area. The area I've circled here, again, would be the body of the scapula. But this groove here that the pointer is laying in, jerking kind of like, is the infraspinatus fossa. The edge here is the medial border or vertebral margin because it's close to the vertebral column. The inferior angle would be this area, the corner, to the inferior of the body. And this is the lateral border. It's immediately beneath the glenoid fossa that I'll show you in a minute. And that's what this is. This flat spot will be the glenoid fossa. It'll show up in other views in this video. Now for the anterior view, or looking at the front with the rib cage removed. Don't forget the rib cage would be covering what you're seeing here. Here's a glenoid fossa. It articulates with the head of the humerus. It's lateral. The lateral border here, this edge at an angle, is beneath the glenoid fossa or glenoid cavity. Here's a coracoid process, very prominent on the anterior, this beak-like structure. And this would be the acromion process, which we saw in the posterior view. It shows up very good in both anterior and posterior views. The superior border, or this edge, or rim. And then this complete corner or edging is the medial border or vertebral margin. Again, that was seen in the posterior view also. That complete vertical edges was the vertebral margin. This slight indentation is a subscapular fossa that is part of the overall surface that's there. It's called the body. That entire surface is the body, and the subscapular fossa was a superior depression there. Here's the inferior angle again, this corner that was also seen on the posterior view. It's the same on the anterior view because it is that corner. Now for a lateral view. Here looking at the glenoid fossa or glenoid cavity, that's where the head of the humerus articulates. And then these two other processes are going to show up quite prominently. Here's the acromion process that articulates with the clavicle. And then this would be the lateral border, or that edge that is just beneath the glenoid fossa. And the coracoid process on the anterior, which will serve for muscle attachments, as will all these parts.